take a look at this video clip over here for me. So this is obviously from the very popular reality talent show called So You Think You Can Dance. And in this dance routine, the two participants are illustrating, even though it's a very elaborate routine, they're illustrating what it's like to do a process that, or a concept that us humans have to be good at, and doing that on a regular basis, and that is that of negotiation. Now, traditionally, this is how we perceive negotiation as being in the center of this table, and there are two people who are dressed up in suits, and it's in like a business setting, and you're doing it quite aggressively. Now, as a healthcare provider, you might also find yourselves in a lot of situations where you will have to also negotiate with your patients. And obviously, this is not the way that they do it. So in this video, I'm actually going to cover with you some examples of situations in which you as a healthcare provider may find yourself doing negotiations with your patients. Welcome back to my channel, everybody. Thank you very much, as always, for your time, attention, presence, and support. For those who are new here and who don't know me, my name is Shweta. I am the founder of Healthy Dynamics, which is a coaching practice where I essentially help healthcare providers who are from English as a second language backgrounds become more empathetic, impactful, and collaborative communicators so that they can build influence, trust, credibility, authority with their patients and stand out in their workplace as a person of excellence. So all of this week on my LinkedIn, I have been talking about this concept of negotiation. We've covered a lot of things such as what negotiation is and isn't, why it's vital for healthcare providers to actually get a good grip and handle of the skill and put it into practice on an everyday basis. And now in this video, I'm going to be actually covering what are some examples of situations and scenarios where healthcare providers from all backgrounds can find themselves in situations where they will need to put their negotiation skills into practice. Now, one of the things that I want to make quite clear before we get right into it is that negotiation applies for everybody. It's something that you as an individual, you do this every day in your life, even without you realizing it. And even though traditionally how negotiation has been perceived is like that way that you saw in the video, in the clip in the very beginning of the video, it is quite different when you do it in a healthcare setting, or you have to apply a different set of skills, and you also have to embody a different type of persona in order to really get good at implementing those skills. Now, in next week's video, I'm actually going to be talking more in detail about what are some of the techniques and strategies you can use as a healthcare provider to become a better negotiator. But to set the scene over here, I thought it's quite important that I give you some examples and context as to what situations are there where you can find yourself becoming a negotiator. Now, before we do that, just again to give even more context. So healthcare has, unsurprisingly changed a lot over the years, and gone are the days where patients, you could just tell them what to do and they sort of perceived you as an authority figure just because you were a healthcare provider and your word was God's word for them. However, that's not the case anymore. Patients are much more completely, wholly aware, and they are much more aware of their rights and what they're entitled to, and they also come with a good base of knowledge themselves, and they will be questioning a lot of things, and they will be advocating for their rights. And that's why a lot of my coaching, we do talk about that, how to be an advocate for a patient yourself, and obviously encourage patients to advocate for themselves as well. And that's the reason why it's vital as a healthcare provider that you really fine-tune and get better at becoming a negotiator. So the way that we practiced healthcare many, many years ago is not the same as what it is now, and it's important that we get with the times. So let's look at a few scenarios where, as a healthcare provider, you are going to be finding yourselves in a position of negotiation. I'm going to be using examples from my own life when I was a patient, as well as other examples of healthcare providers in general. So let's get straight into it. Number one will be when a patient wants to change or alter or stop a medication or treatment regime. Now let's look at a couple of examples from my life. So when I was in my early 20s, I was diagnosed with a condition called polycystic ovarian syndrome. And if you don't know what that is, just Google it. And in that situation, I was working with an endocrinologist at the time who prescribed to me this medication, which was kind of like the morning after pill or the birth control pill. Obviously, I was not sexually active, but I was given that pill essentially to balance out my hormone levels. And I was made aware of what the side effects would be. So I went on this medication for a little bit of time, but then I saw myself not being able to deal with the side effects, which were already compounded by the fact that I had polycystic ovarian. So these were things like weight gain. I put on a lot of weight during this time, blood sugar levels, blood pressure levels, and it started to really impact on my moods and just generally my state of mind. So I went back to the endocrinologist and said to him that either you put me on a different medication or I want to stop this altogether. Now the reason why he had done that, to put me on the medication to begin with, was because he was under the impression that if I want to have children in the future, having that balance of hormones would benefit me in becoming more fertile. And I realized myself that I've known all my life that I don't want to have children. So that's what I went back and told the endocrinologist, that either you give me some sort of an alternative medication for this reason, or we stop it altogether. And yes, we changed the medication for a little bit, and I eventually tapered it off and was able to manage the side effects of polycystic ovarian on my own, to the point now where my hormone levels are much more naturally restored now without relying on medication too much. So that is one example. The other example quite recently was when I had to change the medication for my anxiety and depression. So prior to that, for quite a few years, nearly about 8 to 10 years, I was working with a psychiatrist who obviously was in charge of my medication, what he would prescribe, and also the treatment and therapy side of things. And not only in this case did the medication change, but also where I had to really put forth my stance in terms of our therapy sessions was the fact that he did not know how to put me in a frame of mind or manage me when he kept saying that I have to go back to past events, and so that he can identify patterns of why I am the way I am and why I show up or behave the way I do. And I understand that he's just doing his job. But what I really expected him to do was, when he wants me to revisit these past events, which were quite triggering for me personally, because some of them were quite traumatic. And in that point, I never saw him, trying to reassure me or trying to ask me how I'm feeling after we've had the discussion. And so I said to him that I would like you to either not do that in the future, and if you do, please make sure that you put me in make me feel safe and comfortable before we go on, instead of, because I was feeling that he was doing this all very, very mechanically. To cut a long story short, I stopped working with that psychiatrist altogether, went back to my GP for a different set of medications, which she was quite happy to prescribe. And now I have a therapist who does an incredible job of actually telling me, obviously as a therapist, she's very direct, but also reassuring me during that time of where she'll give me the heads up that this could be quite triggering. So take your time. We'll go at your own pace. You share with me whatever is comfortable for you instead of pushing me for answers and upsetting me even more. So in those situations that are quite tricky and delicate, it's very important that you hear the patient out and not dictate to them what exactly you would want them to do. Similarly, if you're, say, a geriatrician or even a GP in general, and there is an elderly patient that you have who finds it hard to keep on top of their medication consistently. So say they've been given 5 sets of pills that they have to take different times of the day. And obviously when you are elderly, you can have dementia, you can have Alzheimer's, and it's hard for you to remember all these things. And they're not very adept at using apps on the phone on how to remember these things. So if a patient like that comes to you and said that they want to cut down or stop one of the medications or alter them completely, instead of saying no, or saying, oh, go ahead and do that, because even tapering off and stopping medication is a process, you can't just do it straight away. a better way of communicating to the patient would be in a situation like this is, I understand that this is quite overwhelming for you. What if we discuss the most challenging times for you to take your medication and see that we can alter that in a way that reduces the frequency or doses, and also you're able to be you're quite aware of what the timing of the medication is. So this way you're not telling the patient what to do or barking orders. You are working together with them as a team so that they can find that we can come up with a better solution that the patient can actually commit to. Now, this is one scenario. And the second scenario in which you might find yourself negotiating quite a bit is, say, if you have a patient who has a chronic illness, and say one of the symptoms is that they are in chronic pain. If they have a situation like fibromyalgia, for example, and you might be a pain management specialist, and the patient is hoping for a full recovery in 2 weeks' time. Now, we all know that that's unrealistic, that's never going to happen. That's almost impossible. So you can't obviously tell the patient that, because that will be very discouraging and disheartening for them. So in a situation like that, what you can say is that, I know you're eager to get back to your normal life quickly, while we may not be able to achieve full recovery in such a short span of time. What we can do is set short-term goals and targets for yourself, and see how you're progressing with achieving those. And if there are some things in that you find quite challenging, we can adjust that. So there is room for flexibility, but at the same time, you're taking into account what the patient wants. You're holding them accountable at the same time. And that also, it helps them manage their expectations. That also gives patients the power to stay engaged with their treatment and just not leave it completely in the hands of the specialist doctor or whoever it might be. You can have the same situation, say, if you're a physiotherapist or an osteopath. And again, I'm sure that you also treat a lot of patients who are in chronic pain. So in that situation, you can also say something similar, that it's important that we do exercises and therapeutic methods and see how the effects of that are in the short run, and then monitor your progress, and then on a timely manner, we can then set more realistic goals by which you can compound this progress further and further. This is a much better way of doing it, where the patient feels that they are taking responsibility for their treatment as well as their therapy. And at the same time, you are working with them in a team rather than someone who's just dictating things to them and telling them what to do. And finally, the third scenario, and this is quite a tricky one, is when you're trying to educate a patient about how to adopt a healthier lifestyle. If, say, they have a eating disorder where they are binge eating, or if they're bulimic, for example, now that's a completely different category, but just a person who's, say, addicted to junk food and who has a habit of just eating a lot of junk food all the time. And a similar situation can also be adopted for when they are smokers. So everyone knows the repercussions of having an unhealthy diet and smoking on our long-term health. So if you're, say, a dietitian or a nutritionist, obviously you can't sort of tell, especially if they have an eating disorder or if they have a type of addiction, you can't just say to them, you have to stop eating that altogether. Food is something that you can't go cold turkey on, because we all need food to live. So in that situation, what you can say is that instead of it's common sense. Everyone knows that you have to exercise, you have to eat this, and this in order to lose weight, or be in a better state of health. So you can make a suggestion that says something like, what if we aim for 2 days of the week for you to do light exercise and make substitutes? So instead of having, say, potato chips, for example, you can give them the option of having vegetable chips that are baked. Similarly, if they are addicted to soda and soft drinks, you can substitute that for fruit juice. So, and similarly, things like that. So instead of having anything like that, or that you can give them suggestions of vegetables with hummus and nuts and all that. These are just some of the substitutes that you can suggest to them, and make sure that you come up with a system where they stick to it, and you're also keeping them accountable in the process. And being in a position of negotiation does involve you holding the patients accountable and making sure that they are also taking responsibility for their health and playing their part and doing things from their end. Now, these are some of the examples where, as a healthcare provider, you are going to find yourselves in negotiation situations with your patients, and there's several others, but I just want to give you some context into this one. As I mentioned before, next week I will be looking at ways in which you can improve your negotiation skills as a healthcare provider to achieve better outcomes for your patients, as well as consistently give them positive experiences, which is what this channel is all about. So to stay tuned for that video and the rest of my content as well, make sure that you hit the subscribe button and the notification bell, and give this video a like if you actually liked it. And as always, thank you very much for your time, presence, attention, and I will see you next week.